It's the diagnosis no one wants to hear: cancer. According to the American Cancer Society, about 1.6 million new cases of cancer were diagnosed in the U.S. last year alone. Cancer is the second most common cause of death for Americans, exceeded only by heart disease. In the U.S., cancer accounts for 1 out of every 4 deaths. But the news isn't all bad. The survival rate for cancer victims is on the increase. The 5-year relative survival rate for all cancers diagnosed between 1987 and 2009 is up 25% during that time.
I think the improvement in survival relates to the increase in diagnostic testing leading to early detection, improvement in survival rates based upon surgical staging, but largely to understanding the molecular and genomic mechanism of the cancer cell, to learn, if you will, how they tick, and to exploit that to target our treatments for better tolerance and cures.
I think that there have been an increase in survival rates for cancer patients, first because of the earlier screening, the better methods in terms of screening, and of course the treatment for cancers have evolved dramatically over the past 10-15 years.
This evolution in cancer treatment allows a more personalized approach. The patient is more involved in their treatment by making all the treatment information available to the patients, their physicians, and the full treatment team.
Over the last several years, there have been some really wonderful discoveries in cancer care. We today have more therapeutic agents for use than ever before. The real challenge is going to be to determine which treatment options are best for which patients.
Personalized really starts with that trusting relationship between the physician and the patient and their family. Care is also personalized in that now our treatments, particularly our targeted therapies, require us to understand the molecular genetics of each patient individually. And that's the basis of many treatment decisions now.
Regional Cancer Care Associates, RCCA, with locations throughout New Jersey, Connecticut, Maryland, and Washington, D.C., one of the largest oncology physician networks in the United States, is transforming oncology care by ensuring that cancer patients have access to the highest quality, most comprehensive, cutting-edge treatments in a compassionate and community-based setting.
What makes RCCA unique is when you enter one of our offices and begin speaking with our RCCA physicians and nurses, they actually speak to you about you and your expectations. And that helps you make very, very informed decisions about you and your family's future.
When a patient has a cancer diagnosis, it's a very difficult time in their life. And they need a physician to advocate for them, to communicate with their other physicians, and to really create a treatment care plan that is unique for every one of our patients. We believe that RCCA has created this environment and patients are benefiting from it.
While there has been countless improvements in cancer prevention, treatment, and recovery, there is still work that needs to be done. RCCA is committed to these improvements, which is why it conducts over 300 groundbreaking clinical trials.
The RCCA is able to offer treatments for a variety of cancers, including the most common: lung cancer, colon cancer, breast, prostate cancer, to name a few. The treatments that are available can run the gamut from hormonal medications that can be in the form of pills versus chemotherapy versus targeted treatments. We also have a large number of clinical trials that we're able to offer our patients.
We have an academic center at Hackensack that can actually handle the most rare types of cancer. As a result, we can offer clinical trials, first in man, second, third, and fourth phase. So we can handle anything that is presented by a patient and their loved ones.
Cancer discoveries are moving forward at a rapid pace. It seems as though every week a new medicine is being discovered and approved by the FDA. Regional Cancer Care Associates has over 300 therapeutic trials for patients with cancer. These trials will allow people with cancer to live a better life and to have access to the most innovative treatments anywhere.
The main purpose of clinical trials is to give each individual patient the best opportunity for the most advanced and best care that they can get.
RCCA aims to re-engineer the way oncology is delivered in the marketplace. It is at the forefront of value-based medicine, which will maintain access to important treatments while maximizing patient outcomes.
RCCA views the future of cancer care as direct communication to you so that you can make informed decisions about you and your family. We also focus on communicating with you and your other healthcare providers to ensure that we all work together in preserving your health.
We endeavor to improve our relationships with our community practicing physicians and nurse practitioners, who after all are the guardian of the overall well-being of our patients.
As healthcare costs continue to escalate exponentially, RCCA uses compassionate solutions to the high cost of caring for cancer patients. RCCA strives to increase access for those patients who need it most. To learn more about Regional Cancer Care Associates or to find a location near you, visit rcca.com.